time of crisis. I kind of look at this as if you're going to lose $1 million, right? The example of losing $1 million. If you budgeted for that, people expect it, and that's okay. But if you budgeted for $1 million loss, you end up losing $10 million. That becomes a big issue. And although it's difficult to kind of measure and forecast this completely during the middle of the storm, we don't have perfect information. I kind of give the example of filing an insurance claim while your house is still on fire. But if you wait for perfect information, the damage may be insurmountable. So you really need to get started now. You're going to want to set up a dedicated COVID-19 tracking GL and things of that nature, just so that you're prepared for the forecasting. Sorry, Steve, you can go ahead to slide 5. So in a normal market scenario, normally, folks will forecast maybe once, twice a year, and then make adjustments if they're falling off of those budgets. This is not simply going to cut it in this new norm. Essentially, you may have to be running new forecasts once a week or more, depending on when new data comes in and you have more line of sight into what's going on. Things are changing constantly right now, and forecasting is going to be critical to see where things are going, especially when volume comes back online. If you think about the big picture here and the mess that we're in, it's, a lot of it has to do with forecasting, right? You've got the CDC and the WHO and all their different models trying to capture inflection points. You hear of certain areas of the country like New York and Detroit and New Orleans that are kind of peaking almost right now. Areas like Florida, California may peak towards the later end of the month. It's really critical to make sure that you've got good information and that you're really trying to forecast when that pent-up demand comes back. We've got actuaries at some of the large insurance companies that we've talked to that are really expecting, when things come back online, Q3, Q4 into 2021, that providers are going to struggle to bring back capacity in order to meet that demand. And you really need to understand that if that demand leaves, if you have an independent practitioner or a surgeon who is looking to come back online and your competitor is ready and you're not, as soon as that patient or doctor walks out the door, they may never come back. So you want to both understand your costs and your revenue drivers, and be sure not to cut back too much on your expenses to jeopardize that future revenue. This slide really kind of speaks for itself with the title, in the sense that you can't cost cut your way out of this situation, or in other terms, don't bite the hand that feeds you, so to speak. If you focus strictly on cutting cost and that bleeds over to, cutting revenue cycle and certain clinical functionality, then you're probably on the wrong track, and you may end up hurting your revenue more than you benefit the cost expenses. So you really want to be focused on ways to enhance the revenue that you have coming in now. Telehealth is a good area to think about with this, with CMS expanding into 85 procedures that you can bring in-house. And a lot of the insurance companies are working with providers to think about alternative payment methods for telehealth and funding and like that. And then again, when volume comes back online, we've heard of some organizations that are cutting pretty substantially their revenue cycle staff, doing work remotely, and pretty quickly they're realizing that in the long run, this isn't going to last, right? You need to be able to bill and collect in order to stay operational. Focus on the tried and true tactics, as we discussed before, of aggressively working down your AR, potentially selling off some of your AR. Work with your payers from a denial management perspective. You may be able to just get a large lump sum check at this point versus going through each one of these specific denials individually. That could be really helpful. And also work with your vendors to loosen up any accounts payable requirements you have wherever possible. In addition, you want to think about the payer mix shift that we're going to see here. Some of the large insurance companies that we talked to, they've got modeling to see what the impact of 6% unemployment, 12% unemployment, 18% unemployment. And you can imagine, if we get to those levels, there's going to be a substantial drop in commercial enrollment. You're going to see a lot of uninsured or a switch to exchange or Medicaid. And that's a different form of billing and collections. It's also extra work with your revenue cycle staff to get people eligible for these plans, insurance verification, things of that nature. So, at a time like this, it's definitely important to cut expenses and to be lean. but you don't want to do too much and then leave yourself kind of naked on the back end when things come back online. Additionally, it's really important at this stage to kind of think about how your revenue cycle is working with your managed care and how you're working with your payer collectively. Oftentimes those can be a little bit siloed, but now more than ever, you want to bring alignment in those areas. So from a high level perspective, I was talking to Steve yesterday and he gave me the analogy of fighter pilots, and they have kind of checklists, right? And in a time of crisis, the goal is to not lose focus and to stabilize first, right? So he gave me the example of kind of some of the quick checklists that they have, like if your engine goes on fire. And you really only expect people to remember one or two quick things. Then you bring stability, and then you can focus on being more detailed and dedicated in any one specific area. So I really want people to remember these 4 items that we talked about today, not so much that it's something new and you haven't heard about, but that it's something that you want to focus on regularly, and you want to make sure that you've kind of ingrained that focus within your organization, right? So again, shoring up your balance sheet, creating as much liquidity as possible, really tracking to drive your forecasting and your communication, leveraging your revenue cycle functionality to kind of guide some of the strategy, definitely making sure that you're prepared to address this pent-up volume when it comes back, because I think that's going to be one of the biggest issues and challenges that people face is they've gotten so lean and they've tried to control cash flow and expenses that when things come back online, they just can't recuperate it, and you could really lose out permanently and in the long run in that scenario. And that really is kind of number 4, where cost cutting alone is not enough.
Okay, thank you, Mike. We have a couple of questions that have come in already, so we put them on a slide, and between Mike and Mark Doyle, we'll try to get those answered. So the first question is, what is the importance of the relationship with your banking people? Your plan for liquidity, how are you getting cash aggressively and activating credit lines? The follow-up to that is, are you keeping the banking relationships front and center with everything else you're working on right now? And if so, how are you doing that?
Mike, you want to take the first shot at that?
Yeah, sure. So, Mark, you can go ahead.
Yeah, sure. This is Mark Doyle, CEO of Pembroke. But first of all, Mike, great job. You really, I'm work for Memorial Healthcare System, where I have 6 hospitals in South Broward County. But Mike, you hit the nail on the head with everything you addressed so far. All of the items you mentioned, we're diligently working towards. But as far as the first question regarding the banking, fortunately for Memorial Healthcare System, we have 365 days cash on hand. Or at least we did at the start of this pandemic. That's quickly being drained. But so we're in a very good position now to essentially weather the storm. A lot of these standalone facilities or other healthcare systems, for that matter, were not in that position prior to this pandemic. So I think you'll see some of these emerge, or you may even see some consolidation and acquisitions as a result of this. But we have relationships with several different banking institutions that have already reached out to us to assist us. We haven't drawn down any lines of credit yet, but we know it's there if we should need it. But right now we're keeping a close eye on the CARES Act, which will help hospitals across the nation get back on their feet. The methodology right now with they're using essentially the Medicare membership, which could be advantageous for some and not for others. One of the problems we see with that already is that we have a high amount of the Medicare Advantage plans, particularly in South Florida, that will not be part of the calculation regarding the stimulus. So although, listen, we're not going to be greedy, we'll definitely have our hands out for money, but it definitely will not be enough to cover some of the holes and gaps that this COVID-19 pandemic has created. But we're reaching out to other banking institutions if we should need that.
Thank you, Mark. One other follow-up question that has
real quick, Steve, too, if I can just piggyback on that. There's a few examples that we've seen. I was front and center, 2008, 2009, 2010, in the industry and just the economy as a whole. And one of the analogies here that I really like, and some people probably are familiar with, is Ford and Alan Mulally, their CEO, used to be the CEO of Boeing. One of the reasons that Ford did so well during that economic recession and didn't need to call on the government for any funding was that Alan Mulally actually went and pulled down all his lines of credit pretty early on into that recession. So, a different industry, but a good example of how a large organization, similar to healthcare, was able to leverage this type of credit and cash and liquidity so that they didn't need other sources of funding.
That's great. Great point, Mike. Thanks. All right, let's go on to the second follow-up question. What are you doing to leverage payer relationships in what are certainly not normal times? And in regards to that, what sort of out-of-the-box thinking are you using to maintain those, to leverage those payer relationships? Mark, you want to tackle that one?
Yes, absolutely. So, our relationships with the payers, have always been contentious as part of big providers versus the insurance companies. But regardless of that, this COVID-19 pandemic has brought us a lot closer together. Prior to this, we had our own telehealth platforms, or virtual health, as it's now being called. But the payers were never in a hurry to reimburse us for that. But since everything's on lockdown, and insurance companies had a lot of their members looking for access, but what we found, our volumes, essentially are a third to 50% of where they were before. So especially in the ER. So these patients who were previously coming in for care, they're too scared to come in to the hospital for fear of getting sicker. So we definitely leveraged our virtual health technology. And we've reached out, and we have a couple different partnerships with Humana as well as United Healthcare that they agreed to reimburse us without authorization or too much of a hassle for all our virtual health visits. Not only primary care, essentially, that was always a pretty easy way to get paid for primary care, but now they're expanding this to the specialists, general surgery, neurology, cardiology, et cetera. So this is evolving, but I think through this pandemic, it will accelerate the use and acceptance of different forms of medicine and consumerism reaching the patients, and the telehealth, virtual health is I think, in my opinion, taken 10 steps forward, leaps forward as a result of this pandemic. So when hopefully most of the other insurance companies will recognize that there is value versus a patient physically going into an office to be able to do a lot of this stuff, digitally, from behind their laptop or really even their phone. So yes, I think some good things to come from the result of the pandemic with telehealth, virtual health.
Yeah, and Mark, completely agree on telehealth, and just piggybacking on that, a few other areas that we've found in talking with some of the Blues plans across the country. They're contemplating doing interim payments of up to 75% of your normal payment schedule and doing a true up when things come back online. United has actually been reaching out to certain providers and doing claims adjudication, immediate claims adjudication. As Mark mentioned, there is some telehealth stuff. A lot of payers publicly have talked about getting rid of prior authorizations, patient liability, but I think one thing that you should think about is there has never been a time where providers across the nation have had more leverage with the payers, right? And I harken back to the $100 billion or so reserve that Blue Cross has. This may be a time when you have to open up your contracts and say, listen, I know that in a normal market, there's no more quality bonuses in the years of 7-8% annual increases, that they're not going to work. But you may want to go out to your payers and say, listen, this is bottom line, here's the data we've been tracking, here's the cost of this. We need to partner with you guys to recuperate some of this. So don't be afraid to kind of push back on your payers and to really think outside of the box as far as opening up your contracting, maybe getting special rates for next year, payment advances, anything to keep you afloat and to really kind of share in the burden of this. I think you really want to challenge your payers to step up to the plate and partner with you.
Okay, that's good feedback. This is Mark. The kind of follow-up question. So, I had approached it from the opposite way, that the insurance companies would look at this as opportunists to, they know hospitals and providers are going to be squeezed, but to, their interest would be to potentially squeeze us more, knowing that we don't have much of an option. Our backs are against the wall. We're tight for cash. Now's the time there's blood in the water, right? So you don't think that's the case? You think that the providers have more leverage now than the insurance companies?
Well, just from a public relations perspective, yes. I think people in general across the U.S. understand the burden that's put on these healthcare systems, especially on the providers, the physicians, and the nurses. And, it's going to be very difficult. Sometimes we go out of network with some of our clients and payers, and it does become a public relations and a perceptions piece. So if you get in front of this, it's going to be very difficult for a payer in a market to say, we're going to go out of network with this provider, or to not kind of come up and step up to the plate and try to kind of help with the burden.
Good insight. Thank you.